I posted my masked cell hell video 3 months ago, and unfortunately, I'm still in masked cell hell. To watch the prequel to this video, click on the upper right-hand corner of your screen. Treatment for my Bartonella infection has been severely complicated by my mast cell activation syndrome. I have tried over 48 medications, supplements, and herbs in the attempt to treat these two illnesses. These are all the medications I have not reacted to, and these are all the medications that I have reacted to. My biggest hurdle has been that every time I start antibiotics, supplements, or herbs, my mast cells get increasingly more activated over the course of days to weeks to the point where I have to stop them. When I react to a medication, my stomach fills to the brim with gas and I belch uncontrollably for hours. It is painful and nauseating. I also get muscle and nerve pain, lip ulcers, and a headache. I have to strictly follow the low histamine diet, and as my mast cells have become more activated, I have lost the ability to eat all fruit. Mangoes, come back to me. Basically, my stomach doesn't want anything in it besides a handful of foods and water, but it doesn't want cold water, it reacts to cold water. Some doctors are of the mind that the mast cell activation has to be addressed before treating the Bartonella infection, while other doctors think that you can treat both illnesses contemporaneously. Every patient is different, and I'm sure that patients and doctors have found success and difficulty with both approaches. I started treating my mast cell activation syndrome before I even knew I had Bartonellosis, but I would say that I mostly have been trying to treat both aspects at the same time. I try to follow the rule of changing only one medication at a time so I can figure out what I'm reacting to. Even so, often I've had to stop almost all medications in order to untangle everything. Over the past year trying to treat my MCAS, I've learned a lot about available treatment options, so that's what we will be doing today, kids! And since we are talking about specific treatments, I want to emphasize that I'm not a medical professional, I'm not giving you medical advice, nor am I recommending that you self-treat. Please discuss all treatment options with your doctor. Treatment options available for MCAS include over-the-counter medications, prescription medications, and supplements. Unfortunately, we do not have the knowledge nor testing necessary to predict which medications will be effective for each individual. Therefore, Dr. Lawrence Afrin and Dr. Gerard Molderings, two experts on MCAS, suggest that in general, patients should move from least expensive therapies to most expensive therapies. I'm going to focus on first-line therapies. Most of these are relatively accessible, affordable, and not so heavy-duty. H1 blockers are what we generally think of when we think of antihistamines. H stands for histamine, and it blocks at the H1 receptor. There are first-generation antihistamines like Benadryl, and second-generation antihistamines like Claritin, which may cause less drowsiness. It is important to note that just because you don't tolerate one drug in a class, it doesn't mean that you won't tolerate all drugs of that class. For example, I had a very bad reaction to both Allegra and Clarinex immediately. I didn't react to Zyrtec and was on it for many months until it started to make me constipated. I then switched over to Benadryl, which controls my gastritis and body pain much better than Zyrtec ever did. However, I only tolerate the white tablets of Benadryl and not the pink tablets because the pink tablets immediately gave me lip ulcers. Many MCAS patients react to the excipients and medications, which are the inactive substances such as dyes and fillers. Therefore, MCAS patients may benefit from compounding both their prescription and over-the-counter medications. When we think of antihistamines, we generally think of them as helping common allergic symptoms such as sneezing and hives. However, according to the Mastocytosis Society, H1 blockers can help with abdominal pain, headaches, flushing, and brain fog. If I miss a dose of Benadryl, I begin belching and my pain increases. Many people with MCAS suffer from fibromyalgia-like neuropathic pain, and there's a great article by Molderings and Wurz that discusses treatment options for managing this type of pain. One of their suggestions is dose escalation of the H1 blocker. I will put it in the video description below as link number 1. Many patients with MCAS play around with the dose and timing of antihistamines. Dr. Afrin, in his book Never Bet Against Occam, writes that some of his patients take their second-generation antihistamines every 12 hours or every 8 hours, as opposed to every 24 hours. However, this can lead to excessive dryness of the mouth, eyes, and constipation. So some of his patients take a smaller dose, for example, half a pill, 2 to 3 times a day. H2 blockers are antihistamines that primarily block histamine receptors in the stomach, which inhibits gastric acid secretion. Some examples of H2 antihistamines include Zantac and Pepcid. I was taking Zantac until the news came out that Zantac has low levels of a probable human carcinogen. So I made the switch over to Pepcid, and I think it works better for me than the Zantac ever did, so blessing in disguise? Maximum dosage of Pepcid is one 20 milligram pill every 12 hours, but I take half a pill of Pepcid before each of my 5 small meals. Some patients take 80 milligrams of Pepcid a day, which is double the dose. H2 blockers also work on symptoms outside of what we generally think of as allergic type symptoms. According to the Mastocytosis Society, H2 antihistamines not only help with gastric acid, but they also help with overall mast cell symptoms. Now, I don't think that Dr. Afrin mentions this in his book, but I do hope it's true for some people. Let me know in the comments if you find that H2 blockers help your mast cell symptoms outside of your stomach. Some MCAS patients need a little extra help with gastroesophageal reflux disease, or GERD, like me. So a proton pump inhibitor is added to their protocol, like Prevacid or Prilosec. PPIs are not H2 blockers. They are the strongest inhibitors of gastric acid secretion. Leukotrienes, that is how Merriam-Webster told me to pronounce it, are inflammatory mediators released by mast cells, and some MCAS patients may be helped by leukotriene inhibitors. Some examples of leukotriene I'm leukotriene to get this right. Some examples of leukotriene inhibitors include Singulair and Zyflo. These medications can help with respiratory problems as well as all mast cell symptoms. I tried Singulair for a week, and guess what happened? My stomach couldn't tolerate it. So now I'm going into the category of mast cell stabilizers. These include pharmaceuticals and supplements. Ketotifen. I used to think it was pronounced ketotifen, but it's really pronounced ketotifen, but I don't really like ketotifen because it has the word toe in it and feet are kind of gross. It is considered by Dr. Afrin to both be an antihistamine and a mast cell stabilizer. Ketotifen is the active ingredient in these eye drops, and the brand name is Zaditor. But in order to get it in oral form in the United States, you need to have a prescription and you need to get it from a compounding pharmacy. Many people start at a low dose and slowly titrate up to their target dose. I started at 0.5 milligrams, but guess what happened? My stomach couldn't tolerate it. Oral cromolyn sodium, GAM name Brastroprom, GAM name Brastroprom, oral cromolyn sodium, brand name Gastrocrom. Oral cromolyn sodium, brand name Gastrocrom, is a prescription mast cell stabilizer. In the United States, it comes in little plastic vials called ampules. The liquid is placed in a full glass of water and you drink it 30 minutes before eating and before bedtime for a total of 4 times a day. You can also get it in a nasal spray, inhaled form, eye drops, and topically. Only about 2% of cromolyn is absorbed in the GI tract, which, according to Dr. Afrin, means that you don't get system-wide effects. But anecdotally, patients report improvement in symptoms outside of the GI tract. I hypothesize that this is because there are so many mast cells in the GI tract, and according to Dr. Tanya Dempsey, who runs a practice with Dr. Afrin, mast cells cross-talk. So maybe cromolyn is preventing reactions in the GI tract that otherwise would spread systemically. I made that up! Some people have an initial flare of symptoms from starting cromolyn that later subsides. I suggest that you add yourself to the Facebook support group called Cromolyn Users. Patients on that page have wise recommendations on how you might titrate up in order to mitigate negative reactions. I started with 5 drops a day for a few days, and then I went to 6 drops, and guess what happened? My stomach couldn't tolerate it. Quercetin and luteolin are naturally found in foods such as apples and broccoli, and are considered mast cell stabilizers. They inhibit the release of mediators such as histamine and leukotrienes. However, the problem with these supplements is that they are poorly absorbed. Certain companies, such as Algonaut and Thorne, have developed supplements formulated to ostensibly improve absorption. I've tried both quercetin and luteolin, and guess what happened? My stomach couldn't tolerate it. According to Afrin Molderings and colleagues, vitamin C can increase the degradation of histamine and decrease histamine formation. You want to find the most bioavailable product with the least amount of excipients. I tried a powder vitamin C before I knew that MCAS was fucking with me, and guess what happened? All together now, my stomach couldn't tolerate it. Aspirin therapy must be done under the direct supervision of a doctor because it can trigger an MCAS flare and even anaphylaxis. For those with elevated prostaglandins, a mast cell mediator, aspirin can help with bone pain, flushing, and brain fog. Some of Afrin's patients take 325 milligrams twice a day, but he has not seen enough benefit at dosages higher than 650 milligrams twice a day in order to recommend this to his patients, given the risk of GI bleeding and ulcers. Finally, I want to give a shout out to one of my best friends, the supplement called HistDAO, which I affectionately call DAO. It stands for diamine oxidase, and it's a digestive enzyme that your body naturally produces to degrade dietary histamine. You take the supplement 15 minutes before eating, and the DAO degrades the histamine for you. Several companies sell this supplement, but the downside is that like all of them have lots of excipients in them. Luckily for me, I tolerate it. MCAS is a b-hole, to put it nicely. The key takeaway from my experience is that you just have to keep trying. I tried multiple drugs of the same class. I tried multiple formulations of the same drug. I tried playing around with dose and timing. I tried compounding medications. I tried compounding them with baking soda in order to neutralize the gastric acid that was produced when histamine's released. I tried super low doses. I tried extended release. I tried topical medications. I tried intranasal medications. I guess the good news is that there are many things to try. Subscribe to my channel to make me feel good about myself, and also give this video a thumbs up to make me feel good about myself. Thanks for watching! And water. But it doesn't. Did I fuck it up again? Oh, you got some schmutz on your face.